Hey guys, and welcome back to XO Medical Spa with another educational piece and a couple more fun facts when it comes to aesthetics. But for giving it a thumbs up and a subscription, here is a picture of bottle Botox. Now, the way we come up with these concepts is one, you guys leave comments below, so definitely engage with us and give us comments below in regards to what you guys want to hear about. But we also give real life situations. Because I'm a national trainer, I run into a lot of situations that other people might not come up with. Also, because we see so many patients here, I hear a lot of the same questions and concerns over and over. One from patients and then two from providers. So I get to see both sides of it. So as a patient and as a provider, I want to form a nice, good relationship where both people have a plan, both people have decision making, and then in the end, it's a joint effort in regards to forming a good plan to reach that patient to their goal. So let's really talk about why is having a good plan with your provider so important. Living in Southern California, I hear this quite a bit. Con, I want to look natural. I don't want to look fake. I don't want to look overdone. So how does this actually occur? Is it the patient just keeps going and goes overboard? Is it the provider keeps going and going overboard? So there's some dynamic where eventually, to an outward person looking at a specific person, they look overdone. Their cheeks are too big, their lips are too big, they don't look their age appropriate. Why does their face look so different from their neck, look different from their body? So I really want to discuss that dynamic of looking natural and also that dynamic between patient and provider. Now, this could be a very, very long conversation when it comes to looking unnatural. I have many other videos in regards to this as well, so check all of our old videos. But one of the key things I want people to understand is when you come into the practice with me, or if you see me in a training, that conversation that you have with the patient is crucial. One, I want to understand why this patient is asking for what they want, and two, is it something they truly need? In the end, this is medicine. Granted, you're coming in here because you want to look better, you want to look more beautiful, you want to look a little bit younger, but I'm putting a medication into you, I'm putting an implant into you, so I have to treat that with respect. So with medicine, I have to use my education, my years of experience, and really try to explain to you what we're doing here. So, meaning, if you come into me and you say, I want lips, sure, you may want lips because you think you look younger, but what if we talked about other things as well? So during my trainings last week, I talked to the providers. I think they were nurses, nurse practitioners, and PAs. And I mentioned to them, I said, hey, when a patient comes into the office, or when a patient goes into the hospital, a patient goes into the doctor's office, they personally know they're sick, but they don't know why. They come into an office, they have a cough. Hey, doc, I have a cough, but I don't know what's going on. That's similar to how beauty works. A patient may come in and they're like, I look tired, I feel tired, my eyes are just always looking a certain way, but they don't know what's causing it. So a patient may come in specifically and they say, I want lips. Good, that's great. But oftentimes what happens is the patient will come in and they just say, I'm not looking like the way I feel. For some reason, I'm looking more and more tired when I'm on my Zooms. I'm looking at myself on Zoom and my neck is looking a certain way, but I don't understand why. So I, as a medical provider, as your clinician, have to help you understand and get to where you want to be. So I have to really dive into that and understand, hey, are you looking for lips? Are you not happy with your smile lines? Is it your neck? What is truly the case? Now, the other part of this is, am I treating the symptom or am I treating the cause? In medicine, we always want to treat the cause. Going back to our analogy of the cough, if you came into me and you had a cough and I would just say, okay, let's treat the cough. What if the cough is from allergies? What if you have a cold? What if you have the flu? Any number of other situations. I want to treat what's actually causing the problem. I always mention these nasolabial folds because that's commonly what people come in for, because what we promote in fillers. A lot of fillers are studied in this one particular area, which is the smile lines. Aging shows everywhere else, but because us as clinics, filler companies, whatever the case is, we promote a certain area, so that's what patients understand. So the patient comes into me and they're like, hey, can you fill this smile line? My first question to them is, are you sure that's what you really need, or do you want to fix the overall issue? You guys see me do this over and over. When the face falls, it sits on the smile line. That is the symptom of something. You don't just wake up one day and you have a smile line. Your face has to eventually lose volume. You lose bone, you lose fat, you lose collagen, you lose muscle mass, and all you have left is skin, and the skin descends forward and descends down. So those are all the symptoms, but the cause is all back here. So when I have that understanding with the patient, I really dive into it and they're like, oh yeah, that's right. I'm looking tired and old because of this, but what if I fixed everything else that caused it? That will give you a better treatment, make you look even younger, and going back to our original point, keeping it natural. Patients, for the most part, wholeheartedly trust practice or a clinic. If a provider says use Botox, they'll likely use Botox. Use Restylane, they'll use Restylane. Juvederm, so on and so forth. Just like in medicine, if a doctor recommends something for you, likely you're going to trust them and you're going to take that medicine to treat whatever you have. In a practice, one practice may say Botox, another practice may say Dysport. But me as a provider, if I can't verbalize to you why I'm prescribing this, then as a patient, you should have a little bit of a fear why this person can't articulate why they think I need this. So when I treat a person, I really give them that understanding, hey, aging is coming from here, 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 all over the place. Granted, you see jowls, but your jowls are caused by falling. Your jowls are caused by these platysmal bands that are pulling down on you. Your jowls are caused by bone recession in your jaw. Most people don't see that. They see the symptom. They don't see the cause in all the other areas. So as a medical provider, as a responsible clinician, I have to help explain that to you. If you're fully educated, then when I say, let's put in Botox, when I put in fillers, everything has an explanation behind it. And if everything has an explanation behind it, then we keep everything natural because you know why I'm doing things. I'm not just putting in fillers for the sake of volume. I'm putting in filler because I think if we volumize your lips and push out the wrinkles, you'll look a little bit younger. If I put fillers or if I put PDO threads to lift your skin out of the way, it will make you look younger and not overdone. So how do people actually get to that overdone position? Now, I won't put blame on both sides because there's always two sides to a story. As a medical provider, I have no problem saying no to people. My clients come for me over and over and over, and oftentimes I'll see patients week after week after week because they'll say, I don't see a difference, I don't see a difference, I don't see a difference. But for me, I'll show them pictures, and for me, I'll give them my personal side of it as well. If a person gets to the point where their lips look great, not because social media or the public says it looks great, but because it fits the proportions of their face, I will have no problem saying, no, I think you look good. I think we can wait probably 3 to 6 months, and then we can reassess the lips again. Same with other places. Cheekbones, noses, whatever the case is, I have to know when to say no to a patient. But again, I have to articulate why. I can't just say, no, you look good, because a person's self-perception is their self-perception. It doesn't matter what any external factor, what either say, what their friends or family will say. You as a patient will see yourself every day and judge yourself every day. But if I can explain to you, hey, your lips are within a certain proportion of your face, I think this is why it looks good, and I think why you should hold off. Now, one of the best providers you can find is the provider that has no problem saying no to you. Because why? They're taking finances out of the equation. They're not making a quick buck off of you, but they want you to look ultimately your best, and they have your interest in mind. It's medicine. I have to hold your health and your interests first and foremost. Now, what if you have a provider that doesn't know how to say no to you? Or what if you're a patient that's very forceful and says, let's just do it this time? So as a patient, what commonly happens is we forget what we look like. We look at ourselves every single day in the mirror. We look at ourselves every day in Zoom, and we fixate on ourselves when we take pictures. So we kind of forget those big changes that happen because all these gradual changes happen over time and we don't see it. So that's why pre and post pictures are so important, and having that conversation with your provider is so important. Now, if you keep going, and going, you have almost this chase mentality. I want to keep chasing, I want to keep chasing. So your lips get big, You don't see it because you see yourself every day. You want it a little bit bigger. You don't see that change because you see yourself every day. So you keep chasing this moving goalpost. So you'll set a goal, you'll hit it, you move the goalpost. I talk about this in sports because I'm a big sports guy. But you're never happy with your achievement because you keep moving that goalpost back, and back. And that's commonly what happens with aesthetics when it comes to patients. They look better, but they move that goalpost. So they get bigger cheeks. They get bigger cheeks, they go home, they're not happy. So they keep going. And that's usually what happens on the patient side of it. We forget what we look like. So we keep treating, we keep filling, we keep putting in Botox, and it's a never ending fight. That analogy I use with that is like people who work out. You keep working out, you get fitter and fitter. And people, your public, your friends or family will all say, hey, you're looking good, you're looking so good. But you, internally, you'll go to the gym, you'll flex in front of the gym, and you'll be like, I'm just not seeing the big changes. I'm not seeing these drastic changes because you see yourself every single day. Whereas your friends, your significant other, your family, whatever the case is, they may see you a week and a month and so on. So they saw this old you, they see this new you, and they're like, wow, what a dramatic difference. That concept of looking unnatural or fake is very important to me because when I train, when I talk to providers, when I talk to my own patients, one of the biggest things you guys have heard me talk about is age takes things away from you. It takes away volume, it takes away bone, fat, collagen, it takes away your nice pigment. So if age is taking away all these items, all I'm doing is I'm putting it back. If your lips are deflated, I'm gonna put in enough volume to reinflate it back to its original size. If you've lost your cheek volume and everything is falling, I'm gonna put in just enough volume to lift your cheeks and your lower face back to where they wanna be and also make you age appropriate. I'm not gonna turn a 50-year-old into a 20-year-old, and that's commonly how you get unnatural. A 50-year-old comes in and all they want is lips, over and over, lips. The rest of you looks 50, but your lips look like you're a 20-year-old. It doesn't match. So provider conversation, as we talked about, number one, I have to understand your goals, and as the patient, you have to be fully educated. If your provider doesn't know how to educate you, and you're not comfortable with the plan that they came up with, have a bigger conversation or have a second opinion. Second, could it be the provider's fault? Sure, a provider who doesn't know how to say no to their patients. I want to give you what you want. You may want bigger lips, but as a provider, I also have to fully educate you and inform you why bigger lips may not be appropriate for you. I'm going to show you pictures as well, so we can come on that same game plan and have a compromise. And third, could it be the patient's fault? Absolutely. We're our worst critic. We look at ourselves every single day in the mirror. Zoom, we take pictures and we tear ourselves apart. Also, we see ourselves every single day. So we don't see the changes that happen over time. Those big drastic changes happen. We just don't notice it personally on ourselves. And that's why pre and post photos are so important. And lastly, having that relationship with your provider so both of you guys can feed off of each other. And if you guys have made it all the way to the end of this video, thank you for watching the full video. And again, here is a gift of a photo of a Botox bottle. But I'm kidding. So don't forget, if you do enjoy these conversations and you find these educational, share it with a friend, share it with the family. I know they're all looking forward to it as well. And if you really like to give it a thumbs up, and don't forget to subscribe because you'll always get those notifications when we release these videos weekly. I'll talk to you guys later. Bye.